Good afternoon, everyone. My name is Karrie Dudek. I'm the co-founder and CEO of Equalize. We are a therapeutics med device company based in Nashville, Tennessee, focused on transforming patient care through developing innovative vascular solutions. Primarily, we've currently been focused on the treatment of peripheral artery disease. So for those that may be less familiar with this disease, this is marked by the buildup of plaques in the arteries, particularly in the lower extremities. And when this happens, it restricts blood flow to the downstream tissues, depriving them of the necessary oxygen and nutrients necessary to be happy and healthy. This can lead to a number of complications in these patients, so things like claudication, where they've got pain and cramping when walking, associated with a number of risk factors, diabetes, obesity, etc. And there's often a lot of complications in these patients. They can have chronic foot ulcers, ultimately resulting in leg or foot amputation at a frequency that's far too high, and can also put them at risk for heart attack or stroke. So unfortunately, this is a global problem, but particularly in the US, where we've got a high-fat diet, this is a substantial issue where over 20 million Americans are affected by this disease. I guarantee you just about everyone on this call, whether you realize it or not, knows someone that's affected by this disease. That's 1 in 5 Americans over the age of 50 are impacted. And unfortunately, African Americans are 2 to 3 times more likely to receive an amputation as a result. So not only does all of this place a heavy burden on the healthcare system, but it also serves as a heavy financial burden. So hospitalizations alone cost over $7 billion annually. So there are currently a number of treatment options out there, ranging from lifestyle and medication, which don't typically stick in this patient population, ranging through the use of catheters and stents, as well as atherectomies, and more complicated surgeries like that, using a donor graft to perform bypass surgeries. And again, amputation is always an option. So these all have their limitations, particularly when looking below the knee, which is where we're most interested. The use of drug-coated stents and catheters are most commonly used. However, they're not perfect, and they certainly don't serve as a long-term solution, as we see failure rates as high as 40 to 60%, which is within just 12 to 18 months. What does this mean? This means that a patient comes in, gets this device implanted, might see some benefits for a few months, but then within a year to 18 months, they're back having another procedure done, and often have more complications than they did to begin with. So we've developed GelCAD, and I'll touch more in just a moment on what that is, but we see our technology being used across the continuum of care, but ideally being used as a frontline treatment option before these more expensive and invasive options. So GelCAD is a novel arteriogenic hydrogel solution. It's an injectable gelatin-based hydrogel that contains an active peptide that promotes the growth of new, large, smooth muscle-lined blood vessels. So these vessels grow within just 2 to 3 days of delivery, and we see perfusion and integration into the existing vascular network within just 7 to 10 days. So we've currently got a formulation and are continuing to optimize that formulation for easy controlled delivery in the clinic. So admittedly, this is a space where there are a lot of big players, right? I mean, you've got behemoths here. You've got Boston Scientific, Medtronic, Abbott Vascular, and the like. However, they all rely on those physical devices that I was just talking about, and there currently doesn't exist a technology on the market today like ours. This puts us in a position where we're poised to disrupt this revascularization landscape. So compared to those other options that I talked about, we can handle bulk blood flow, but we're also minimally invasive. So there's no surgery, no OR time required. It's just an injection. We see shorter healing time, and we're working with the body to promote natural blood vessel growth, leading to long-term efficacy. So exactly what does this look like? How would this work? So we would identify where the occlusion is in the patient, and this could be used in combination with other therapies, of course, like most things. And then with just a couple of weeks, we'd see increased blood flow, improved healing, and improved patient outcomes. We've actually been able to achieve this in mouse models. So we've worked with Vanderbilt University Medical Center and vascular surgeons there to perform femoral artery ligations in mouse models, where we're able to restrict blood flow roughly 50% to the lower extremity. And then we treat with either our control or active hydrogel. So within 2 weeks, what you see in the controls is what you would expect to see. Severe necrosis of the tissue, severe muscular atrophy, and more often than not, those animals unfortunately lose that limb. In our treated animals, we haven't seen any signs of necrosis, even at the most distal points of the toes, minimal muscular atrophy, and often you can't even tell they've had a surgery. We've actually aged a small cohort out about 6 months, and we don't see any aberrant effects. So no abnormal growth. These vessels are stable. They still have full functionality of the limb and are happy and healthy. This is just another data set to kind of highlight the improved blood flow. So in each of these columns, we've got our treated gel CAD, a scrambled, which is just the same amino acids. It's not peptide, but scrambled, so that's functionally inactive, and then just the gelatin base hydrogel. In each of these images, the left limb that you see is the one that's been, the surgery's been performed on. And these are, you can consider them heat maps, right? So you see red, yellow, that's where you see you have more blood flow. So at day 1, which is the day of surgery, you can see that we're reducing blood flow to that lower extremity. And then we treat with the respective gel. And then within 2 weeks, in our controls, you can see that those animals, again, unfortunately lost those limbs. And then in our treated animals, we see restored blood flow at that 2-week mark. And again, happy and healthy. And I'll just show briefly, we've also done some micro CT imaging where we've been able to trace those blood vessels within that network. So in this column, you've got just a typical healthy limb to kind of give you a baseline of what those networks look like. And this on the right is a ligated limb that's had the surgery performed and it's been treated with our active hydrogel. And you can see a robust increase in the vasculature there. So this is, again, a large market opportunity. If we looked even just at the most severe patients at the highest risk for amputation, we're looking at a $3 billion sum. What I'd like to point out is that there's a large market opportunity in other verticals as well. So obviously we can have a huge clinical impact in the peripheral artery disease space, but there are also opportunities in other areas such as bone repair, hernia repair, diabetic foot ulcers, and the like. And we're exploring some of those now. We're actually doing some pilot studies in the orthopedic space based on a lot of customer discovery efforts that we did on the front end. We've got patents filed. We've actually, our key patent was, our non-provisional was filed at the end of 2021. That's currently under review. So we've filed in the US, Canada, the EU, and Australia. So what's unique about our technology as well, as some of you may have picked up on already, is it will be a combination product. So the gel itself being the medical device, and then the peptide considered a drug in this case, and we'll be following the IND pathway. Oops. So far, we've gotten a lot of traction in the last couple of years. We've worked on our formulation and have performed those in vivo studies, some of which I've shared with you. We've also been involved in a number of accelerator type programs, NSFI Core, the NIH Startup Challenge. We've participated in MedTech Innovator Road Tour. We've executed a licensing option, and we'll be executing a full license in the next couple of months. We've applied for a phase 1 SBIR this year, and that will actually be being scored next week. So fingers crossed that comes through. In the next kind of the rest of the year, we're bringing in some formal regulatory consultants. Even though we've had a lot of advisors, we want someone on our team dedicated to that, putting together our advisory board. And moving forward, we'd like to take the next step into large animal models to prove out bioefficacy in a more translatable model, forming strategic partnerships and expanding our team, as well as starting to collect those IND enabling data sets. To accomplish some of those goals, as I mentioned, some of the biggest costs being large animal models, and expanding our team and bringing in those regulatory experts. We're seeking to raise around $5 million in the coming months to achieve those goals. Our team currently consists of myself, Karrie Dudek, co-founder and CEO. I'm also a postdoc in the Aspire to Innovate program at Vanderbilt University, and my co-founder, the inventor, and our chief scientific officer, Dr. Ethan Lippman. And we are supported by a number of key advisors that we've put together around us. These are all folks that have experience in biotech-based startups, biomaterials, pharmaceuticals, and the like. And with that, I will take any questions.